Hello, in this video we'll be going over patient registration through the patient portal from the patient perspective. First thing, after you enter their email address into ENT Cloud, it's going to trigger an email that looks like this here in your inbox, where it says welcome Andros ENT. So if you click on here, you'll see this is the email. You can see here where it says complete registration. And then also some instructions down below, but also we also email instructions as well. So you should read through the instructions thoroughly that one of the staff members should be emailing out. So you just click on complete registration. And what that'll do is bring you to the patient portal where you're going to verify your date of birth and set up a new password. A reminder that the password can only be letters and numbers. No special characters like exclamations or question marks or commas, anything like that. It has to be only letters and numbers. So you see here, you scroll down, it's asking to verify the date of birth. So we'll go ahead and enter this fake patient's date of birth. Hit continue and it should ask for that new password. So again, only letters and numbers. So we'll enter that. As long as you get it correct, it should immediately ask you to log in with your new password. So we're going to go ahead and put in that new password. Okay, so now we've successfully logged in. And as you go down here, so first page is you need to accept or acknowledge our terms of service here, our practice privacy policy attestations, and the assignment of benefits. If you want to actually read through them, if you just click on the link, what you're going to find is that it actually will pop up, and you're more than welcome to go ahead and read through all of that information. Once you've read through everything, what you do is you're going to want to check each one of these after you have read and opened and gone through that. It's not required, but it is recommended. So then you're going through, you can add in additional information if you'd like. So I'm just going to add in my middle name. You can add anything. So in this field, you're going to see that your date of birth is X'd out, but we know the date of birth is correct because it doesn't allow the patient to change their own date of birth or their social security number, because some of these are tied into insurance billing, so it only can be done by staff members. But we know the date of birth is right because you entered it just to get into the portal initially, so we do know that that is correct. The social security number is not a required field for insurance billing any longer, so we automatically will put all nines in there. Occasionally an employee will put something other than just all nines, but don't worry about that. Otherwise, you're going to go through, you want to verify your information. So we're going to say employed. If you choose to update and upload your own file from your computer, you can do so by clicking here and then just uploading your own file. But otherwise, you're just going to go through and answer all of these questions. Then you just hit submit changes. And what you're going to notice here when you hit submit changes is it brings you back and it reloads that same page with all that same information. What it does not do is take you to the next section. To get to the next section, so that's section 1, what you do is you come back here to My Health Record, you click the drop-down bar, and you see now the personal information has been done at 100%. Now we're going to move on to contact information. So you click on that, it'll load the page, and again, you want to verify your address here. If it isn't correct, you can delete, you can hit details to change it, or you can just add another address if you have more than one billing address. So you're going to want to confirm all this information. The one that you do need to add is an emergency contact. So let's go ahead and add an emergency contact. So I will add in, let's say, a fake spouse, or you can enter in anyone. And then you're going to want to enter in whether it's a landline or if it's a mobile phone, again, for the text messages. So again, I'm just going to put in a fake one. You can put in an email address if you like, and if you would like that person to actually have portal access to help you with the portal ever or to enter things for you, you can go ahead and put their email in and select here, and that will allow them to get in there. So again, you want to indicate who this person is. We're going to say this person is the spouse. So once you're done, you hit submit, come back down here to My Health Record, and so contact information is still at 50%. Let me see if there's anything there we missed. No, we got everything. So there are going to be some fields that you're going to notice that don't say, oh, communication preferences, that's what I forgot. So if you come down here, what you can do is you can add how you prefer to be communicated. So what you need to do is you go here, so appointment confirmation. You can select how do you want those appointment confirmations to come through. You could say, I want a telephone call, email, which is what the one we recommend. Email is probably the best way, but you can go ahead. We do have the text. So if you want to do the text, now you see the text automatically will go out, but if you check here, it's going to opt you out of the text messages. So you can just select whichever ones you want. Make sure to hit submit. And unfortunately, you do have to go back to that same one for each one of these preferences. So the first one was for appointment. Now we need to do appointment recall. You can see the previous one's gone. So for appointment recall, how do you want to do that? Again, I'm going to just select email, hit submit, go back down, add a preference. And as you can see, it's adding those preferences. Here are the two previous ones I've done, and you can always edit them. But we're going to add another preference. So test results, also I'm fine doing those via email, but also maybe you just want to call. So we'll say telephone call cell, go ahead, hit submit, and come down, add preference. And unfortunately, we're working on getting this updated. As you can see, when you click on it, it brings you back to the top of the screen every time. We are working on the coding for that to get that changed, but that's just how it works right now. Health maintenance reminders, you know what? For those, I'm going to say I want to opt out. I don't want those health maintenance reminders, so I'm going to opt out at that. But you can indicate whatever your preference truly is. And then the last one is patient education. I'm going to say I just want those via email as well, so you can hit submit. And then now that should be done. So now if we go back to health record, we can see contact information's at 100%. So now let's move on to medications, another required field. So under medications, you have one of two options. If you're taking no medications at all, you can just check this box, and then you will be done with this particular portion of this portal. But if you have medications, the easiest thing, you hit add new medication. Works pretty easily. You can enter in anything, either the common name. So let's say I take lisinopril. So you can see here, when I just start to type it in, you have all these different options. If you really don't truly know what you're taking, you can always hit unknown dosage and form. But let's say I'm taking 10 milligrams. So you can see it automatically updates some of that information. You can go ahead and change this as necessary. So if you're taking maybe 2 or taking 2 tablets a day, or you're doing other, so you fill that out however you want, you hit submit, and then again, you'll see that it's there. So after it's entered, you can edit it, delete it, but let's go ahead and add another medication. Now let's just say I take aspirin. So let's say aspirin. I'm going to say I'm taking the low dose right there. Yep, 1 a day. So you can hit submit there again. Let's do one last one here. Let's say, just pick one. Let's see. So let's say, I don't even know what this is, but let's choose that one. Let's say I just don't know what the dosage is because I don't have it in front of me. You can choose as much or as little as you want here. What we would like is just as much as that, and then your frequency if you know that. So let's say I take that 2 to 3 times a day. So you can hit submit there. So that section is done. So now this is one of the exceptions. If you come back up to here to my health record, what you're going to see is medication still says 0%. And so will allergies when you complete that. The reason those remain at 0% is they will remain at 0% until you come in and see one of our staff members and they do what's called reconciliation. So basically what they're doing is verifying the information is correct. If there's any information they need to change or alter or give you education on, once they've completed that quote-unquote reconciliation within our portal as an employee, these will update in your patient portal to 100%. So they will remain at 0%. So we're done with medications. Now I'm going to move on to allergies. So just like with the medications tab, you're going to see you have an option, I don't have any allergies. So if you do, you just click that box and you're done. Otherwise, you hit add new allergy, and we're specifically looking more so for medication allergies or any specific allergies. You could put seasonal ones in here too if you like, but we're looking more for medications. So let's say I have a allergy to, well, I can't say lisinopril, but we could say we can say I have one to antihistamines. Well, let's see here. Let's do that one. What type of reaction do you get? Let's say I get swelling in the throat and vomiting. But it can be any type of reaction that you get. You want to enter that in. If you do know the date that first occurred, you can click here and enter that date. If you're unsure, you can go ahead and hit reaction date unknown. Go ahead, hit submit. So once you enter in all those new allergies, then you're done with that section. Again, if you come up here and see allergies is at 0%, and that's okay. Next section would be the pharmacies. So what you want to do here under pharmacies, the easiest way to search is just come to the zip code, enter in the zip code of the area you want to pick up prescriptions in. So let's say here 55076, which is Inver Grove Heights. Just enter in the zip code, hit search. It should pull up all the pharmacies available in that zip code. So I want to go to this Walgreens here. You go ahead, hit select. And you're going to see it's going to come up here. And let's say I want to make that my primary place that I mostly pick up from. But let's say I occasionally pick up medications from another pharmacy. So let's enter in a different zip code. So maybe I pick up a specialty one at a different pharmacy closer, let's say, to work. Let's say I go to this CVS right here. So I'm going to go ahead and hit select. And you're going to see that one gets added too. So that way, if you pick up different things at different places, it's good to enter in all the places that you go to. So now we're done with pharmacies. So you go down here and see it says 100%. Next one is medical history. Now this tab's going to take you a little bit longer. So first thing you need to do, so mistakenly people a lot of times will enter in, I have no medical history. We are a specialty clinic. So if you're making an appointment here, we don't see people for wellness checks. You're here for a reason. So even if you have never had a diagnosis, you can still enter in your symptoms. And I'll show you how to do that. So first thing you do is hit add new condition. So you can see it opens up all of these different fields. So first thing I'm going to do is just enter in, let's just say I'm going to enter in the symptoms I'm having now and I haven't had a diagnosis. You can click on other here. You can go ahead and free type anything in here. So let's say I'm going to put in stuffy nose and dry throat. So I'm going to put those in. Again, these are optional. You can enter them in if you do know them. But when did this condition start? I'm just going to say, let's see here, we'll say around April 1st. So you go ahead, hit submit. And you can see that added. But now what I'm going to do is enter in past medical history. So let's say as I go through here, I've had some neck pain. Maybe I have some arthritis. You know, I've had some headaches. Sinusitis. So you can enter in as many as you do, but whatever ones you enter here, you want them to hopefully be around the same date of start. Just if you could put that, that does help the doctor to know how long you've been dealing with it. But let's say on these ones, I'm not really sure. So I'm just going to leave all that because I'm not really sure how long I've been dealing with them. Maybe it's been many years. So you can go ahead and hit submit there. But you're going to want to do that till you've completed with all your past medical history. If you don't see it in that drop-down area, like I said, you can free type and add that stuff in there as well. So the next section here within this, in your medical history, is surgeries. Do you have any past ones? If you didn't, just check that box and then you're done. But I'm going to add a surgery. So you can see here, it'll free text, or not free text, but it'll give you some options here of what you've had done. So let's say I've had a septoplasty in the past. If you could, try to enter in a date. So let's say I had that. Well, maybe I'm not really sure the exact date, but let's say I knew it was around the beginning of the year. So you can do that. If you're really unsure, just know the year. You can just put like January 1. We would appreciate if you at least put down the facility, even if you don't know the doctor's name. So we'll say I had this done at Regions. So you can go ahead and hit submit. Okay, so now we're going to add one that's not listed here. So what you can do is you can go ahead. Actually, it looks like that section, we're not going to be able to add that. There should be another other section, but that's okay. If you don't find anything on here that's not being able to add properly, again, when you're having your visit with your doctor in our office, you can go ahead and let them know, like, hey, I had this surgery and I couldn't get that added. We can add that in manually. So the surgeries are done. Family history, again, if you don't have anything significant to report, click that. Otherwise, if you want to add here, so first thing you want to do is select who are we talking about. Let's say my mother has a history of high blood pressure. So let's go down here. We're going to find well, you're just going to select, so there's high blood pressure or hypertension. But let's say she also has history of obstructive sleep apnea. Maybe she has a history of sinusitis. And just like before, you can also select other and free type. Maybe she has a history of ovarian cancer. You can see that sometimes it'll try to fill in too. You can put in any comments like she's deceased. So we're going to hit submit there. So that's going to, you'll see that added that information. So now we're going to add, so you can see you have a lot of options here on who to add. But let's say father, I'll just go say he has emphysema, depression, diabetes. I'll just add, so add in everything that's pertinent. Again, you can add in information here. You could add in whatever information you want. So do that until you feel that it's completed properly to your satisfaction. And then lastly on this page, are your immunization records up to date? It's just a simple yes or no. If you hit yes, if you feel that it's not completely up to date, you could go ahead and add immunizations manually, just like we did with the other ones. You can see you can add them, same thing as before. You can add as much or as little information as you want. Then you hit submit, same thing, and then that will get that part completed. So then if we go back up to my health record, we can see that the medical history now is 100%. Now we're going to go to social history. Social history, do you drink, do you smoke, do you have any other kind of habitual things? So have you ever smoked? So let's say I am a former smoker. When did you quit? Let's say January of 2016. And number of packs a day before. Let's say I had 1 pack a day and I smoked for 10 years. So you just want to put in that information. Again, it's not required, but it is very helpful for us to understand your whole health history. Do you drink alcohol? We'll say yes. What type do you drink? I drink, let's say, beer, liquor, and wine. How often do you drink it? Let's say I'm drinking it frequently, and I'm drinking, let's say, 10 drinks per week. But you can put whatever frequency fits for you. At least illicit drug use. So you can indicate here yes or no. You know, if you hit yes, you have to type in what. This isn't a required one, so you don't feel necessary to answer that, but I'm going to go ahead and answer that as I feel comfortable. So other habits. You can put in here, I drink coffee 2 cups per day. You could put in any other information, but we'll just put that in. So you're more than welcome to put what other history, and especially like if you exercise, you can put that information as well. So you can go down here and say exercise 30 minutes per day. Go ahead, hit submit changes again. So you can do that as often as you need. So if we go down here to my health record, as long as everything's been completed to your satisfaction, then you can go into insurance information. But a lot of times we're going to verify that. But if you'd like to do this field, you can. So you go ahead, hit on there. But most times we like our own employees to enter that. But you're more than welcome to do that if you do. It's a little more complex. But you can hit here to yes. Is the patient the insurance policy holder? If it's not, what it's going to ask you to do is enter in the policyholder's information here. So you're going to need their first name, last name, date of birth. Again, Social Security numbers aren't required, so you could put all 9s. Relationship, is that person a son, daughter? You know, what's the relationship? What's their gender? This is their ID number. So the insurance card number is the ID number off the insurance. You want to put in the address for the policyholder, and that may be different than the actual patient that's being seen. So enter in the proper one, their phone number to the insured, and what type of phone is that? Is it a home phone, work phone, cell phone? So these you have to select here. Is it a Medicare plan, or is it a Medicaid or medical assistance plan, or is it other? Other would be like Blue Cross Blue Shield, so forth. So you can enter in the information you want, but again, it's not necessary because we will enter that, and we should be taking that over the phone as well. And that's the easier route to go, is to give it to us over the phone when you schedule that initial appointment. So once that has been entered, the only other one is my healthcare providers. We should be obtaining that if you don't know it, but if you do know it, we appreciate if you can enter in your primary care. So let's say either your primary care, I'll just enter in Dr. Rosario. So the easiest way to search is select the doctor's last name if you happen to know it. It's a lot easier the more information you have. Select the state, hit search providers, and what you're going to see, it's going to pull up all those providers with that name. So I know my doctor's name's Inel Rosario. I do know she's in Inver Grove Heights, so I'm going to go ahead and hit select. And you're going to see that will there. Do I want to call her my primary? You can go ahead and do that if that's the case. If it's not, don't indicate that. But you can add as many doctors as if you want there. So once that's been done, you can come back up here. You can look, and the rest of these aren't required for registration, but you can. So if you come to My Practices, here, this is information where you can enter in practices that you might, whether it's Entira or Children's or whatever, you can enter that information, but again, not required. You can also enter in directives if you so have a directive. Immunization, drug history, consent. You can enter in directives here. This is, again, not a required field, but you can go ahead, enter in this information. So if you have a device, you can enter that in. If you don't know that information, then I would say it's best to just give us that information verbally during your appointment. So we'll go back up here. This is the last part that I want to show you, and this is a real critical part. In this area, add shared information. So if you need to share files with us, let's say you have some health records at home from a prior clinic that you've been treating at, and you want to share that with us. As long as you have that information digitally on your hard drive, what you can do is hit Add Shared Information. You can call it, let's say I had a CT scan of head. So then what you're going to hit is Document. Then you hit Choose File, and what you're going to want to do is find that file on your hard drive, wherever that has happens to be. So you're going to go ahead, select that information. I'm going to go ahead and hit cancel, but you're going to go ahead and select that information, and then you just hit submit. And then what that will do is it's going to upload that to the patient portal, and it will allow us to have that information. And that goes both ways. So we can share that information with you in that same field. So I'm going to go back here. Again, additional shared information with the practice. If I had shared, or if the clinic had shared information with you, it'll be in this in this field here. You'll be able to download it, view it, and vice versa. So once you have uploaded things, if you no longer want it there, if you uploaded it yourself, you can go ahead and delete it. But if you do, you just want to make sure that we received it prior to deleting it, because once you delete it, it deletes it from our end as well. So we just want to make sure if you do upload something that we properly upload it to your patient file prior to you deleting it. So it's best just to leave it there unless you feel you need to. So that's the patient portal to complete registration properly. You know, there's some other information here. So if you want to contact our office for any reason, let's say you had a question for Dr. Azario, you can hit topic, clinical. It's going to open this up. So it's going to enter your name, select the provider you want to message. So let's say I want to message Dr. Azario. Here's where you enter in whatever you need to ask. Now, this is HIPAA compliant and it is secure, so you can enter in specific information. So let's say, you know, my lisinopril medication is so you can enter in whatever it happens to be. I'm going to actually not send the message just because I don't want her to have to actually see that message because it's just a test. But once you hit go ahead submit, it'll go to Dr. Azario directly, and then she'll be able to, it'll show up in her portal and she'll be able to respond to that when she does get an opportunity. So you can see there's a lot of ways that, you know, you can request an appointment, you can do a refill, if you want to just refill a medication, if you want a referral, if it's a billing question, clinical. So you can go ahead. All these are available for you to message us. Again, they're HIPAA compliant and they are secure messaging. So you can go ahead and do that if necessary. So you're going to want to also, you're going to want to save this as one of your favorites, just so you can come back to the portal as necessary. But once you're done bookmarking that, you're going to go ahead and just go here to log out. And that will complete your patient registration. So if you have any issues, you're more than welcome to call us if you're having trouble with the registration. But otherwise, like I said, be sure to bookmark this just so you can return to it as necessary. And thank you for your time.